I created this program to do all the good things that everybody wanted without the corruption. I'm going to do my best to present this, and I hope that you find it as exciting as I do. Thank you. Okay, let's break this presentation down. I'm going to do a better job of this. This is just a quick computer graphics I drew. These are my 4 insurances. This is just an example. That's a central processing agency. The font's kind of small, and that was my fault. I was planning to go direct, but I decided to do quick. These are medical records. These are doctors. That's Uncle Sam. This is John and Jane Doe. And this is John and Jane Doe's employers. Now I'm going to explain this on a whiteboard so it makes it a little more simple. I'd like to explain how this system works. These represent the basic insurance companies. It could be 10, 25, 30, 80, don't matter. This is a central processing unit. Now currently each insurance has in them their own underwriters, adjusters, and everything. They pay for those. All of them will be moved to this. What they do is they'll cut their agents and everything will be transferred to here. This is like what a bank uses to process their checks. They transfer checks. They pass them out through a central processing agency. The insurance companies no longer insure people. They insure a flat percentage. These represent the medical records. Every medical record in the entire United States is held in one place, which is electronically accessible to any doctor. Now, the doctor would have to agree to be signed up under this program, but all doctors, 100% of all doctors, will be in network. Furthermore, all doctors who are in network will be issued a USB key for his office, for him, for her, for the hospital. That will give them access to these medical records at a given spur. We'll get to more, but let's just say that a patient was on vacation, had something happen to them, maybe they had seizures. Any doctor in the entire world could access the medical records of that person as long as they had internet in a split second, find out their medications, everything. Furthermore, life insurance can access these records. There's one central. There's no more fraudulent insurance. That will drive prices way down, and we'll keep on going. The only function the government has in my entire process is to make sure there's no hanky-panky. Basically, what cops do. Make sure the law is abided with and there's no criminal action. Basically, here's John and Jane Doe. And I apologize for my graphics. I try to use computer, but it just didn't work out like I wanted. John and Jane Doe, their employers, contribute to this. Now we'll get in more to this, but essentially they'll choose one plan, and I'll describe that in a minute. Their employers no longer choose a plan. They contribute a specific dollar amount based on their choice. They choose a plan based on their choice. That plan follows them to any job, anywhere, retirement, it doesn't matter. It's there for life unless they want to change to a bigger or smaller plan, or maybe they add a family, they need to upgrade or downgrade because they've lost a spouse or something. Make a simple short, these insurance companies will bid for a percentage of the entire insurance industry. They no longer choose people. They bid for a percentage. Maybe this is a large Blue Cross and Blue Shield and they want 20%. They have to come up with 20% of the coverage. These people will be all the people here that are no longer needed that are tossed here. They will be a non-profit organization. They're not really a business. They are, in a sense, they're non-profit. They basically maintain the records receive the money and get the premiums and pay out. This system is so incredible, it totally blows Obamacare out of the water, and I'll get more into that in a minute. Next, I would like to explain to you where the premiums come from. We're using a single premium set, yes, a single payer system. A lot of times, good and bad are real close to each other, but there's usually a distinct difference. The reason we have a single payer system, we're getting rid of the government. We don't want it, but we do need a single payer system. However, we've always put them together. This is not together. The premiums come in one big pile, and they're managed by that central processing unit, not the government. Companies that are paying for their employees now put a dollar amount. If you work for a company that pays good benefits, they don't have insurance anymore. They will say, okay, we're doing so well, we're going to put X number of dollars into your medical plan. Remember, if it's a husband and wife, each company will put into a single plan, and I'll explain that. The individuals can choose to add money into their plan. Maybe they want a better plan, and I'll explain that. So the individuals have the potential to keep adding money to their own plan. States, under the Medi-Cal and Medicaid provision, states will contribute if they want. Everything is about if you want. Nothing is forced on you in this plan. It's a free choice. Furthermore, as long as the government keeps their hands out of it, this plan will be insanely awesome at helping people. And then the federal government for Medicare. All that money will come into a single bank. The insurance companies, which I didn't draw, will receive in direct proportion to the percentage they're responsible for. Again, if you have a company that says, I want to be responsible for 12% of the people in America, they're actually paying 12% of the bill. They don't even know the people, and it's not important. Some of their people will be very old, and some will be very young. One of the great things about my plan, a 90-year-old person with a heart problem costs exactly the same as an 18-year-old kid. There's no difference. We'll get more into that in a minute. Real quickly, this is a simple one. All the insurance companies will bid on the percentage they are responsible for. These are represent the insurance company. I forgot to draw my line, don't diss me. And these are the total costs. The bigger the circle, the bigger the responsibility. The bigger the responsibility, the more they're responsible for percentage of cost. Let's just say in any given month there's $150 billion worth of medical expenses. If they wanted 10%, they're responsible paying 15% of the bill. They don't cover people, they cover a percentage. Every month they cover a percentage, but the direct percentage which they cover, they also receive in payments. Now, I'm not going into the plans here, but this is just giving you a quick idea of what the plans, how they're going to work. The actual plans will have to be designed for a team. What I mean by that is a team will have to say, this plan covers this percentage, that plan covers that. The plan will have 5 plans, A, B, C, D, and E. However, you may, at your own expense, and we'll cover that later, switch to a higher plan, but it'll cost you personally out of your own pocket. The good thing is you choose your plan. But if you're under Medicare, the government will flip the bill for that plan. That means you have a good balanced, but it's not the most awesome. At your own expense, you'll go there. If you're on Medicaid, you'll go here. I'll explain that. But as an individual, you can have any of the 5 plans. They just cost more as you go down to Plan E. Okay. Now, obviously, I don't know all the figures. I don't have them. So this is an example only. Here you got plan A, B, C, D, and E. This is your worst. This is your best. If you got the money, this is the plan everybody wants to go to. These are the amount of people in the plan. Well, currently, if you're a single parent and you got a child, you have to claim single, or at least most of them, a single and family. Even though there's two of you, it's a lot more than just saying a couple. Under this plan, it's the number of people. So if you got one person, it's one. If you got you and a child, it's two. Regardless of whether that person's a spouse or a child. It doesn't matter. If you got three or more, it qualifies you at that. Here's an example. If you got plan A, you might have $100 for one person, $150 for two, and $200 for three. Go down here, you might pay plan E for one person, might be $1,200 a month. If you have two people, might be $1,300, and example, $1,400. If you're a smoker, but only one smoker, you would add 15% to the cost. Why? Obviously, the costs are substantially higher. If you got two smokers, it's 30%. I think we should cap the two smokers. What that means is if you got an 18-year-old child that smokes, I think we leave it at 30% and call it a done deal. They're young. It's not likely to affect them before they get on their own. But this is just a quick summary. And I apologize. The picture I showed you on the computer was far superior. I put a lot of work into it. However, it's on a file that can't be transferred to the program I'm creating this in, so I'm doing it kind of my limited resource. So you have 5 plans. Your family will choose one. You'll only have one plan for the entire family. All key points on here. So I'm going to show you the first few. Here's some of the key points of the plan. No one is forced to use. Unlike Obamacare, they want you to pay for the people who don't want to work, who choose to be poor, or who are illegal. Under this plan, you don't want to be part of it? No. It's no problem to anybody. Does not hurt. Because it's so good, unless you just financially don't like it, you have nothing to lose. It is so good. The plan is not based on age. They really don't care whether you're an 88-year-old single woman with massive heart problems and emphysema and COPD, again, or if you're just a young person. The companies contribute based on dollar amount. Your company will no longer choose your plan. That's also number 5. You go to work for a company. The company says, okay, we'll contribute $200 a month, $800 a month, $2,000 a month. We will contribute. The good thing is if two people, could be significant others or spouse, if both work for a good company, the individuals won't be paying anything because the companies will put one plan and they'll both contribute to that same plan independent of each other. So the plan you choose, any plan you want, whatever they contribute, you contribute the difference. If you got a husband and wife and you both work for really good companies, chances are you won't pay anything and you never will have duplicate coverage. 2 people, 2 jobs, 1 plan, and no duplicate coverage. Right now, because you're paying for duplicate coverage, i.e. a significant other or a couple, what happens is you're wasting a lot of your money. The plan's getting wasted, and huge waste of everything. People choose your plans, not your company. So if you work for the sorriest company on earth and says, you know what, we don't make enough money, we don't want to contribute to your plan, it doesn't matter anymore. Maybe you think it's important. Maybe your company gives nothing. Maybe your spouse plan, maybe your spouse has a company that has agreed to put $500 to your spouse's plan, but your company says nothing. So you pay the difference. You and or your husband or your wife will pay the difference. So you choose your plan for your own self. This means control is in the individual. Forget the government. We don't need the government for this. We choose our plans. All doctors that are signed up, which will probably just be by everyone, there's no reason not to, will be in network. That means there's none of this garbage about well, I can't go to this doctor. All doctors are a network. There is no difference anymore. You have a central point of medical records, which no more will you have problems with, like I said, life insurance, and no more will you have problems with a doctor not being able to find out in emergency what meds you're taking, do you have, what kind of disease, what kind of problems you have. If you pass out in a mall on a vacation in the Bahamas, and maybe you forgot your meds, maybe you're diabetic, you got to wait till a doctor comes. With this, they can even pick up a cell phone that has internet and scan it, bring up your records from a cell phone. Now, you still would have to have the USB key, so it will be controlled. Still, you have your Privacy Act and all that. But the point is, a doctor anywhere in the world, and this could go worldwide if the doctors agree to it. And it still would be totally separate as far as cost to anybody in the world. So if you're on Medicare, and you go, you know, Medicare don't pay very well, but maybe it is important to you. Again, you can say, you know what, we're going to pay the extra dollars, and we are going to choose a better plan. The plan follows you, not the company. So if you are one of those people that work at 7-Eleven and jump over to the video rental and work at Burger King, and maybe each one does or not, it doesn't matter. Your plan follows you. You can start out with Plan E if you want to as a child, and die as a 98-year-old person and have the exact plan through hundreds of companies and jobs. It doesn't matter anymore. The plan will be with you, and you control it 100%. Insurance companies and doctors make more money. This will bring doctors to America much faster. When I explain how much better it is for doctors, doctors will fight to get into this program. Insurance companies will make a little bit more money. Not a lot. It won't make but probably a few billion a year. And you will pay much, much less. I won't go into all the details, but no duplicate coverage. I'll get to more of the things. Companies can be flexible year to year. Let's say you work for a company that this last year did really well. And like a lot of 401ks, they can contribute a lot more money to your health care. But if they start out real good, and they have it like the economy is now, they'll go broke. So instead of collapsing it, you say, you know, they can say, we were putting $500 a month per person towards the benefits. We can't do it this year. We can only go $400. The companies can be flexible without a total restructuring of them. This gives massive flexibility to the companies, which means companies will gladly support this ideal because it doesn't cause them financial harm. Anytime they're getting close to bankruptcy, they can say, look, Mr. and Mrs. John Doe. This is only an example of costs. I'm showing you on my computer screen because it's a lot easier because of simplicity. Here we have Jane Doe and her company, and we have John Doe and his company. Together they've chose Plan D. Plan D costs, as an example, $775 a month. Let's say her company only wanted to pay $200. Now right now, our company pays a lot more than that. But let's say her company only wanted to pay $200 and his company only $175. Jane Doe says, well, I'll come up with $175 more, and John says, I'll come up with $225 more. If any one of these pay more, they can pay less, but total, they pay $775. This will allow them to choose the plan they want. If they want to go to Plan E, they can obviously increase their amounts. But maybe her company will increase, you know, $500. Remember, $200 is nothing. $175 is nothing. It's very well possible her company could put $500. His company could put $500. Their out-of-pocket benefits would be extremely small. A quick example of Medicare. John and Jane Doe, they're a retired couple. the government pays 100% of Plan C only. So whatever Plan C was, and I don't have that right in front of me, the government, that would be the plan for Medicare. But let's say they wanted Plan D. So they would have to pay $300 more out of their own pocket to cover Plan D. Hard on me because I'm not feeling good. Let's get to the malpractice insurance costs. This is actually one of the big things that hasn't been addressed. This is an insurance company, okay? This is the insurance company that generally would pay when you go down and get sick. Now, I just showed them here as insurance, but it would go through the central processing before it goes to the doctor. What happens, and here's a doctor. The doctor, right now, the insurance, here's how it works now. The insurance company, the doctor bills the insurance company for, let's say, $100. The insurance company pays $100, but the doctor has to pay all his expenses. One of those expenses is malpractice insurance. Approximately 25% of everything a doctor makes goes to malpractice insurance, approximately. Depends on what field you're in. So they have to upfront the $100. The doctor takes and gives that gives $25 for the malpractice. They stockpile it until when the doctor's messed up, and then they pay it. So from here to here, the money goes up front. From here to here, they stockpile it until a suit. The people who are penalized are the good doctors. The doctors, like car insurance, are paying for something, and the only ones that use it are the bad doctors, the ones that screw up. The good doctors lose more money. It's not right. So what I've suggested is take the people who actually pay your bills. Remember all the insurance companies? They agree to cover the doctors 100%. In other words, we now cover your malpractice insurance. Instead of just doing one insurance, they do. Here's the advantage. First of all, this other insurance, they have to pay up front. So this other insurance has to make a profit that we didn't show right now. They don't have to make a profit off this, and they don't have to stockpile it. So they're cutting their expenses by 25% approximately up front. The profits they made, they get to have. So they can actually reduce their rates even lower. They agree to cover the doctors. As long as the doctors do nothing wrong, the insurance cover is in exchange for the lower rates. That means they send out 25% of the less money, which means they can invest that money. All the profits that the second insurance made, they would make. So they're making more money already. They agreed to give the doctors. Now, if a doctor comes along and does screw up, he already gets lower gross rates, but because he doesn't have to pay the medical malpractice, because the first insurance, in exchange for the lower rates, gives them the free coverage. If a doctor messes up, he would be required to pay a lower premium for 5 years, with every year being at 20% less. This way, the bad doctors, I don't say bad, the ones that messed up, now personally out of their own pocket are penalized out of their profits. Right now, if a doctor messes up, big deal. His insurance covers it. Sure, they go up a little bit. He passes that on to the customer, and it just gets higher and higher. With my policy, the insurance would do the free coverage. In exchange, the doctors would get less up front, but they would get to keep more because they don't have to pay that insurance. Now you go, what about the lawyers? The lawyers cap them, $100,000 plus costs. The reason is malpractice insurance generally is the easiest of all legal lawsuits to, prove as a general rule. And because it's so high malpractice, lawyers are often making millions. They're putting the doctors out of business because the doctors can't afford this super high malpractice. But under this system, they're capped, which means they do a coverage, but because the lawyers are capped, because they don't have to pay for the insurance profit, and because the doctors get a lower gross profit, but they get to keep a bigger chunk. Their taxes are lower, and they get to keep more of their money instead of paying these insane malpractice. You get to reap the rewards of all of this because the rates are going to be lower overall. So your output would be massively cheaper than the current system. Now on this, what I would like to say is this is just a simple flow chart, but this is a very important flow chart. When you go to a doctor, you don't know how much it's going to cost. It's like going to a mechanic going, I don't know. When you go to a doctor, the doctor would have a set of flow charts. This doesn't tell him or her how to do their job, obviously. But when you go to a doctor, you see, if you go in, i.e. for a broken arm or sprained arm, you got a hospital visit. You know that if it's real bad, it could be x-rays. More likely, it will be x-rays. You might have a cast. You might have some pain medication. When you walk into a doctor, you'll have these flow charts. They would be broke down in major areas, i.e. limbs, internal, eye, ears, nose, and throat, those kind of things. So I didn't go into detail on the flow chart. What you're seeing is just a generic flow chart. So when you go to a doctor, and we'll get into the actual cost now, the doctor says, okay, he punches your name in, you got Plan C, for instance. Now, we'll get to the costs in a minute, but he'll be able to look in without even calling your insurance, without contacting them. He'll look at this plan and say, okay, if I do this, which is a reasonable plan of attack, if you wish, then everything in these steps are covered in this percentage. If you go to a doctor for a broken arm, and he has to, and there's a blood test, but you had a broken arm, then the blood test would need to be contacted to the insurance, or how much are you going to claim. It's not that it wouldn't claim it, and it's not that a doctor may have other issues he or she's dealing with, but what it does mean is they can look at a split second and know that you're covered under this policy without having to contact the insurance night or day. You walk in, this is your problem, blah, blah, blah. These are the procedures which would be acceptable with. Now, you can do anything as a doctor. I'm not saying you can't. But under these steps, you can do anything and cover, and you know it's automatically covered without any further approval, which speeds up and reduces cost. On this is an example of cost. Now, I use a generic name, the test 43. If you go to a doctor and the doctor requires a test, and in that test, we'll call it 43. What happens is the insurance will pay $125 max. Remember, all the insurances combined. They feel that that test is worth $125. Now, the doctor can charge $200. But what's important to understand is the doctor knows at a snap of a finger that the insurance, all insurances he's dealing with, will pay $125 for the test. He's free to charge, or she's free to charge whatever. You notice that Plan A, you see the word 20%. That means that the patient has Plan A, 20% of it is covered. So you take $125 times 20%, that means the customer is responsible for 80 1% of test 43. Test 43 could be anything you want to call it. It could be blood test, it could be urine test, it could be a stool sample. The term is not important. I use a simple 20%. Plan B was 40, Plan C is 60, Plan D is 80, and Plan E. So when you go to a doctor, and the doctor looks upon that flow chart I was looking at, he knows real quick you're approved for this amount. Wham! You know your cost. So there's none of this ambiguous. It speeds up everything. They don't have to, if you go in, like I said, for a broken arm, well, there's nothing wrong with getting x-rays. You don't have to go ask the insurance, does your insurance cover x-rays? Because you know exactly what percent is covered. When they leave the doctor's office that day, you will know exactly what your bill is. There's never an ambiguity in the expense. And if you have, for example, on this one, Plan E, 100%, you always know that 100% of test 43 is covered by insurance. This is a different example. This is called procedure 27. Again, it doesn't matter what it is. It could be putting a cast on. It could be removing an ingrown toenail. It doesn't matter. I'm just giving you an example. The max charge that the insurance will ever cover is $327. Again, that's just a made-up number. The point I'm trying to make is when you go to a doctor and you go in there for a checkup and the doctor does a basic office call, then he does a special checkup. Let's say this special checkup is a max of $327 because it's called procedure 27. He can look at your Plan A and go, oh, your insurance covers 25% of it, or he can go down to Plan E and say, your insurance covers 100%. If he sticks within that flow chart, the doctor doesn't even have to contact the insurance company and say, is it okay if I do a procedure? Because he knows it's not a problem. If you go in for an ingrown toenail, you don't need to call the insurance. Is it okay to cut it out? It's a give me. How much they cover, you already know. The doctor doesn't waste time. It's solved. And when you're finished, he will tell you what your charges are. You'll walk out there knowing your bill, which could get more money to the doctors if they're going to get paid right then and there instead of waiting, maybe billing you, you're not going to pay it, or whatever. You can take it off your credit card or whatever the doctor wants to work. The point I'm trying to say is the doctor will know your charges instantly, always. Now, what I've added is right now there's a shortage of doctors. One, because the government is squeeze them so tight that it's not to their advantage to be a doctor anymore. They're getting tired of going overseas. This is a new thing I've added on. This allows legally and medically qualified people to open up their own facility, as long as, of course, they follow all the guidelines and laws. I'm not saying amateurs here. What they would do, i.e. a nurse or an ECM or something, what they would do is they would be allowed to open up a facility, but they would only be allowed to facilitate limited amount of medical. You can do vaccinations, skin rashes, springs, ingrown toenails, cut fingers, remove shallow cysts. This is only an example. There's a lot of things that a nurse is more than capable of doing. They would be able to open up their own facility. Now, this would massively help doctors, because right now, if you got an ingrown toenail, you go to the doctor. A nurse can do an ingrown toenail. Granted, there are times when a nurse might not be able to, but nurses are not ignorant people. They're very well qualified, and they would be able to. So a nurse could go out in the country where a doctor may say, you know what, there's just not enough patients. A nurse could go out in the country, open up a clinic that only allows like minimum services, he or she could make a really good living, but they would be able to go into an area where a doctor could not survive a complete office, but maybe a single person, qualified person, would be able to go and take care of all the little bumps and boo-boos that we go to the doctors for, colds and stuff like that. If they can't handle it, obviously they would send you to a doctor. This would also reduce costs. So let's say you live in West Virginia. Well, the main doctor is over 40 miles away. But let's say you have a small issue. For instance, we do a lot of midwives. They could be qualified. So in the middle of the night, your wife breaks her water. She would be able to go down to one of these local clinics, if they're qualified, and as long as the baby didn't have complications, i.e. breech birth and stuff, would be able to do the same thing without a doctor's supervision and be able to effectively and economically provide services in more rural areas, in areas where doctors would not. Maybe a clinic in a downtown ghetto area where a doctor doesn't want to open up these, $2 and $3 million clinics with 8 to 10 people, but a qualified nurse may have a secretary, may have 1 or 2 staff members, and could open up a small clinic. This would make health care available to everybody, and it would allow the doctors to work on the more complex issues, which means doctors' time would be more utilized constructively. You don't need to have a mechanic with $100,000 tool do an oil change. That's why you can go to Walmart. That kind of ideology is what I'm talking about. Little tiny mini healthcare facilities can be opened up all over the United States, which would mean a lot more healthcare to a lot more people, reducing costs, because right now you go to a doctor for a cold, you might as well go there for a major operation. It's going to cost you so much to see the doctor. These things would massively reduce costs. It would allow qualified people to meet the needs, and people would have more access to medical. This is a quick other key points. The Central Processing Agency would just basically, when the doctor gets, when the insurances pay each month, pay the cost daily, they would collect from the insurance companies. They say, insurance, you owe this much. When the people pay in, it would go directly to the Central Processing Agency, and that's where all your adjusters, underwriters, and things like that used to be. The doctors can access your medical records anywhere in the world. Any doctor who signed up under this program, even though I'm not into a global issue, this could eventually allow global doctors to access, doctors in Germany could access your medical records that have to have a USB card, that have to be, a key, which is pretty secure. They'd have to sign up for it, but essentially, and every time they logged onto your records, it would be recorded. So it's not like the Privacy Act would be violated. Insurance, life insurance would be reduced, because when they look at you, they already know that you have cancer. Right now, it's a maybe. They don't know. And those are the main key points. I won't highlight all of them for now. I'm going to go over this last part fast, because I feel like I'm double talking here. Insurance companies would basically bid on the amount of their responsibility they wish to cover, an exact proportion to the income they wish to receive. Okay? So they're bidding on not the number of people, but the percentage of the bill. They don't deal with you anymore. The insurance companies flip the bill, they get the premiums. That's it. Their costs are simple. They can have tiny buildings with only a few people on staff and make more money than they ever made before. I'm not against companies. You have a single plan system where nobody's forced and everybody pays if they want into the state. Now, you can still have insurance companies branch off and do their own thing. It's not based on your age. You have 5 choices of plans to choose from. Doctors would receive more money, but gross less, just not having to pay the malpractice insurance. But when they did, they become more responsible. When you got a doctor who's already taken a 25 approximately % cut, then all of a sudden he goes, oh crud, I left scissors inside. He's now got to dig into his personal profits. It now has a little bit of personal meaning. It means better quality of doctor. You got a doctor who's really screwing up, he won't be around long. Insurance will have to pay less because they don't have to pay the malpractice part of the other company who makes their profits. You have the delay of less output up front means they can invest money. If a malpractice suit, they still have plenty of money to cover that. It's not, one insurance company does not cover all malpractice. They all cover a proportion. If the lawsuits that day are, i.e., maybe the lawsuits are $50 million for that day, the insurance is who took the responsibility. If you got 10%, you're responsible 10% of that whatever million there is. Okay, and the doctors, well, we've already discussed that. Insurance companies will no longer required to hire agents. Now, some agents may not like that, and there is some disadvantages to that, but they don't have to do claim adjusters. All that processing staff will now be in a central unit. There'll be nonprofit in the central unit to help them. Their only purpose is to pay employees, so it'll be a job, but it won't be the profit organization will be under the insurance companies themselves, so they can work for the insurance companies, i.e. a percentage, but they don't work for one company. They get paid based on all the companies. Okay. And I apologize, I used a format that is not very comfortable. The doctors would have access to your records. Life insurances would be cheaper. Patients would be able to go from job to job. There would be no need for COBRA anymore. You will be never rejected for pre-existing for conditions. So when you sign up, right now, like you do at a job, you get your anniversary where you can make changes. If you get married, you have kids, you can add or modify. But generally speaking, you can't just go day to day, change plans. But your plans are not based on your age. Because the employers contribute a dollar amount, they have really no say-so on your plans. Other than, obviously, if you got a good employer, you might want to consider a better plan. If an employer is having problems, he or she or the company could raise or lower what they're going to pay you next year based on their profits. They're not doing really good. Instead of putting them out of business, instead of them saying, I'm sorry, you lose everything, what they could say is, we can't contribute $500 a month, but we can do $150. We're barely hanging on. You work with them, they work with you, employers work. You have one plan, so you never do double coverage. That is a huge benefit. A lot of people don't even realize. When you pay double coverage, they don't look at it, well, the other insurance is going to pay their part. They look at it as they're fully responsible, but they're not. They don't each pay a full amount. They each pay, the main company pays one, and I won't get into the main company, and the second part covers it. So you're paying for something you don't ever really receive. You have full control over your plan, so your plan sticks with you regardless of your age, regardless of where you go. If you work, you don't work, it doesn't matter. The only thing the government does is make sure there's no hanky-panky. No doctors are out of network. Sorry. The one thing I included is smokers pay a 15% higher premium per individual. If you got 2 smokers, you would, at this point, pay up to 30%. Why? Because you're going to cost a lot more. It's just a give me. The thing about it is, even if you smoke, you still qualified. Here's another good thing I haven't really covered. If you have if you're a parent and you have 1 child, well, actually I did cover it. You now get 2 people instead of a parent with a family. This will save costs there. You know about the medical, the doctor. Okay, states could limit expenditures on Medicare and Medicaid plans. The state would be able to choose the plan, but generally they'd be Plan A. Another thing is apologize about that. With Medicare, you certainly have full control over it. The government no longer tells you that right now we have death panels. Senior citizens don't understand what that is because they've never had to deal with such corruption. But in a death panel, when you're 70 years old and you have a brain aneurysm, they don't fix it anymore. You know what they do? They give you comfort medicine and tell you to wait till you die. Well, at 70 years old, you're still pretty active. You don't want to hear that they're not going to waste money on you when you paid all your life. That's the kind of stuff you get with Obamacare. Not with this. You get the best of care always. So lawyers are going to look forward to seniors coming in because the more you come in, the more you use their services, the more money they make. There's nothing wrong with providing services and making money. With the nurses and the certified persons, you get more offices opened up, especially in rural areas or areas where doctors may not open their own clinic. You have your, I've already covered it. I apologize, I'm going over this fast. The plan would cover children up to 18. I know a lot of people go, well, I want mine up to 26. Your child's grown at 18. They can die for the country. They can smoke cigarettes. They can vote. They're adults. It's time you let them be adults. If they're not adults by 18, if they're in high school per se, then you can let them up to 21. But they're kind of adults. Let them grow up and be adults. You might be a grandparent while they're still 26 years old. That is ridiculous. It's an insult to intelligence. If you have Medicaid or Medi-Cal, the state could require you not to smoke. You go, well, that ain't going to work. But they could also force you to go into a healthy education program if you want the free state handouts. You don't take it. You know, there's always your own pocket. Why should the state be responsible for your medical, and then you shove cigarettes and junk food in all day, and you're going like, well, that's ridiculous. Why should we be responsible for your irresponsible? I would just like to summarize this by ending one thing. This will cut costs huge amounts. Every person in this country will be able to afford will be able to afford medical insurance unless you are dirt poor. But you should be able to still afford some. It puts the responsibility back on the people and it gives them control. Nobody is forced. If you don't like this program, you can still go get your old traditional medical insurance with Aetna or Blue Cross and Blue Shield. You go to the doctor, it would be billed the old way. Nobody is forced anything. That's the American way. This is not like Obamacare. We're not shoving anything down anybody's throat. We're putting freedom in front of you. It is a single-payer system, and generally people look at that in fear. I remove the government. Granted, the government could still overtake everything like they do right now. But under this plan, your costs will be reduced. The lawyers will be the only one who really won't make a lot more money, but they'll still make up to $100,000 plus all their costs. Then you have the doctors who don't have to worry about malpractice insurance. You know, they're good doctors. They're not some half amateur hour. So costs are massively reduced. You don't have to pay a second insurance company. And with this plan put together, the American people, the word insurance for health insurance won't even be an issue. It'll be a little bit more expensive than an average electric bill, and unless you have a really expensive plan, it will be, I don't say perfect, but it will be insanely better than Obamacare. I look forward to hoping that you like this. I will try to answer questions. I do apologize for the crudeness. I am sick and I am at a hotel, and I hope this explains everything. Thank you.